The electrical events that normally take place in the heart initiate cardiac contraction. Disorders in the electrical activity can induce serious and sometimes lethal disturbance in the cardiac rhythm. The rhythmic beating of the heart distinguishes it from all other organs. The normal heartbeat is initiated by a complex flow of electrical signal called action potential. The action potential results from highly coordinated sequential changes in ion conductance through gated sarcolemmal membrane channels. Rapid upstroke of action potential is designated as phase 0. The upstroke is followed immediately by a brief period of partial early repolarization, that is phase 1. And then by a plateau, phase 2. That persists about zero point 0.1 to 0.2 seconds. The membrane then repolarizes, that is phase 3, until the resting state polarization, phase 4. The phase 3 is final repolarization. And phase 4 is restoration of ionic concentration. Increases in transmembrane potential from a resting value of minus 90 millivolt, sometime it may be minus 80 millivolt, to approximately plus 30 millivolt. The rapid upstroke, that is phase 0 of the action potential, and result primarily from a sudden increase in sodium ion permeability. This permits a large inward current of sodium ion to flow down an electrochemical gradient by means of voltage and time dependent fast sodium channels. The upstroke is caused by a regenerative process, that is, depolarization leads to sodium influx, which lead to further depolarization. The rapid opening of the activation gate for the fast sodium ion channel, M gate is activation gate, and H gate is inactivation gate. The ionic basis of fast response and genesis of the upstroke we will discuss later video. The rapid opening of the activation gate for the fast calcium ion channel is immediately followed by a slower closing of inactivation gate, which interrupt the influx of sodium ion into the cell. The membrane must be fully repolarized for inactivation gate to reopen and conduct another action potential, a process called recovery. In phase 1, the notch is the initial rapid repolarization phase of action potential, which is carried by potassium ion and to a lesser extent sometimes it may be chloride ion conductance. In phase 2 of the action potential is unique to cardiac muscle. This plateau phase results from a balance of inward calcium ion and outward current of potassium ion. The slow inward calcium ion channel is activated at threshold potential about minus 50 millivolt. Maximal at approximately 0 to 10 millivolt. Peak rapidly and inactivate slowly. Some sodium ion channel remain active and carry a late sodium ion current throughout the action potential plateau. Increased activity of this channel contribute to the abnormal repolarization and increase intracellular calcium ion. In heart failure and ischemic heart disease, phase 3 is the final rapid repolarization that restore resting potential and is caused by inactivation of calcium ion current and an increase in the outward potassium ion current. Several ionic potassium pumps contribute to the plateau and repolarization. The inward rectifying potassium ion current, that is IK1, a potassium ion conductance that generate the resting potential, turn off during phase 0 and is inactivate until repolarization begin. It also generates a small outward current late in repolarization. The transient outward potassium ion current, that is I2, or responsible for the initial phase 1 repolarization, and the delay outward current, that is IK, the primary current responsible for initial final repolarization, turn on slowly at the final phase of action potential. After repolarization, the sodium potassium ATPase pump extrudes accumulated intracellular sodium ion and pump extracellular potassium ion into the cell. Ionic balance across the sarcolemmal membrane is also maintained by a action of a sodium calcium exchanger. The ionic basis of the fast and slow response and all phases we will discuss in later video. Thank you. Don't forget to like, share and subscribe my channel.